You know the content that is on the exam. You feel confident and competent in your knowledge, and yet you still fail the exam. Well, you're not alone, and that's exactly what we're talking about in this snapshot. Why is it that nurse educators or nurses or nursing students feel confident and competent to take an exam, but yet they're not successful? We want you to go ahead and pull out your study worksheet if you haven't already. That's listed right here in the description. The next step that we want you to take is to write down today's date, whatever date you're watching the snapshot, and what is one takeaway that you want to have at the end of our time together. When we're looking at learning outcomes with our students, that should be our goal. What is it that we want our learners, our students, to walk away having a better understanding about at the end of our conversation? Because that's exactly what classes are. It's really about conversations we're having with our students related to concepts, related to knowledge that is going to help them provide safer patient care. Welcome back everybody, to Dr. Siller's Educate, where our mission is simple. It is to support all nurse educator colleagues on the journey to achieve excellence, whether that's the C&E exam or maybe some colleagues out there, our nursing colleagues, are watching this snapshot in an that we're doing as nurse educators or as nurses. So we are in our devotional using our devotional called Rooted in Wisdom. And this is specifically for nurse educators to help us stay focused, motivated, and to also help us remember our why. We're focusing on day 7 during our time together today. And this specific quote is associated with encouragement and just reflecting on the impact that we have. Every great educator has moments of doubt, but commitment to purpose keeps you moving forward. Your teaching makes a difference in ways you may never see, but know that your work is not in vain. Mahatma Gandhi says, the future depends on what you do today. I'm going to say that again. The future depends on what you do today. I see all the time on social media and even talking to colleagues around the country about the challenges they're seeing in the classroom, and they are real. Even my friends that are in higher education, that are not in nursing, and even family members and friends that teach in high school and middle school and even elementary school, talk about the academic climate and the challenges that they're faced with. And here's the reality, it's not a lot different. Whether you have incivility situations with students in high school or in college, because it happens, or maybe students are just not showing up as prepared as we need them to be. We're all faced with similar challenges in our classroom, in our clinical, in our simulation and lab experiences. And we have to stay grounded. We have to remember our why, knowing that we have a specific purpose and we're going to use the tools, the resources we need to do a good job, and most importantly, to refill our cup. So just take a minute to reflect and remember the value that you're bringing into those learning experiences with your students, and just know that you are making a difference. When we look at the failure rate of the C&E exam specifically, even though it's moving in the right direction, it's still not as high as we would like for it to be. We continue to have a 98 to 100% success rate depending on the exam. And part of our focus is following that 7-week study plan. So colleagues that follow the plan, we see 98 to 100% success rate with those colleagues that are focused, that are using only the resources that we recommend, which are Billings and Halstead as our primary textbook. For our content today, you can go ahead and turn to page 489 in the 6th edition. We're focusing specifically on not only test taking strategies that anybody can follow, whether you're taking the NCLEX or CCRN or C&E or CHESI. And we're also adding another layer to our conversation, and that is related to exam analysis. So colleagues that know the content but still end up failing the exam, there are some specific reasons why that we're going to get into. When we talk about failure on the exam, it's really honing in on where you are today. So thinking about the fact, number one, that exams test application, not recall. It's not just a simple memorization process that you want to go through. You want to make sure that you're understanding the why as well as the what. Let me give you an example. When it comes to sterile technique, you all know the example I like to use, which is Foley insertion. But when we teach students sterile technique, we have to put it in context. So what does that mean? We don't want to just talk about the 7 steps. We also want to share, if we can, a video is always great, of an example of a patient that develops a hospital-acquired infection because we didn't follow sterile technique. Okay, that's going to create more meaning, which is called salience. That's going to create more meaning as to why students need to follow all the steps that are associated with sterile technique. The second reminder we want you to consider as you're preparing for your exam is that those distractors, which are the incorrect answers, are specifically designed to test your thinking. When you get to the C&E exam, you should expect 2 good answers, okay? You will have 150 questions, 3 hours to take the exam. There will be 3 options. Only one of those options is correct, and you will have 2 distractors. Sometimes there can be a distractor as well in the stem of the question. Okay, so you want to make sure you're clear, number one, about what the question is really asking you. Number two, what is it that you know for sure about that specific concept that is included in the question? So just remember that distractors are designed to attract those students who are not as knowledgeable about the concept. If you have a low level of knowledge, which when you look at pages 188 through 190 for the cognitive learning domain, that's going to sit at remembering, okay, or maybe even understanding. But to go deeper, you got to be at that application and analysis level, okay? The third reminder we want you to consider is clinical judgment. It requires prioritization. When the students walk into the room, we want them to be able to recognize that something's not quite right. Well, when we're taking the C&E exam, we want to remember what teaching strategies we are using to help our students develop clinical judgment. We want to make sure that the learning that we're developing for our students, that partnership that we're developing, that we are intentional in scaffolding or building on prior knowledge. This is a key part of the development of clinical judgment. So if we don't have the skills as a nurse educator to truly value and leverage the importance of scaffolding and understanding the 3 learning domains and how our teaching strategies align with each level of learning, then our students are going to struggle with applying and really understanding clinical judgment. And ultimately, it's going to lead to unsafe nursing practices. Okay, so we have to think about how we're prioritizing, how we're aligning our curriculum to ensure that students are developing those clinical judgment skills, those safe practice decisions that's going to lead them to the delivery of consistent quality care. Consistency is the key. Okay, we develop that foundation with the strategies that we're using to help our students achieve success. So you may wonder, okay, what does this have to do with the exam? Well, because the exam is all about application. It's not enough just for us to understand the content that we're teaching. We have to be able to understand how we facilitate and truly transfer that knowledge to our students, to our learners in a way that they can make safe patient care decisions. I wanted to share this example of the teaching experience that we saw in a previous cohort that we had in one of our programs. So you will see there were 23 responses, and we have 43.5% of colleagues that had 5 to 10 years of experience. More than 10 years, we had 13%. And then 43.5% had less than 5 years. Now, this information is important because what we know is that there is not a strong correlation based on the information that we have gathered from colleagues across the country, and we continue to collect that data. There is not a strong correlation between experience and the ability for you to pass the C&E exam. Now, we do know for colleagues that have at least 3 years of experience, there was a strong correlation because you do have the experiences to align with the concepts that you're learning about in Billings and Halstead. However, we know experience is not enough, right? We have to be able to ensure the teaching strategies that we're actually using actually align with the evidence-based practices. Quantity, the years of experience you have do matter. However, it's that qualitative component, the alignment with the evidence-based practices that really allow you to leverage these years of experience to contribute to you being successful on the CNE exam. Okay, so that's why we wanted to share these years of teaching experience and the correlation between what you do with those years of experience is what's most important. All right, so let's take a look at the thought-provoking question and see what you think about this one. We have changed up our thought-provoking question. We're going to go through the question and then we're going to talk about the rationale for the incorrect and the correct answers. Okay, we have three options for this question. And as we're unfolding the options, we want you to go ahead and write down right now what is the rationale for your thought about the correct and the incorrect answer. A nurse educator notices that students frequently choose partially correct answers on exams. Which strategy best supports improved clinical judgment and test performance? A, encourage students to memorize key content areas and review quiz questions before exams. B, provide additional review sessions covering missed content topics and those complex concepts. Or C, teach students to analyze answer choices by prioritizing patient safety and outcomes. All right, so remember your two strategies for answering your questions. Number one, what is this question really asking me? Number two, what is it that I know for sure about the concept in this question? All right, so if you chose A, that is incorrect, which was encouraging students to memorize key concepts. Memorization may improve the recall of facts, but it does not promote clinical judgment or the ability to distinguish between multiple, plausible, realistic, possible answer choices. Nurse educator and certification exams emphasize application, analysis, and prioritization rather than rote recall, rather than just simple memorization. Okay, that's why A is incorrect. If you chose B, that is also incorrect, which was providing additional review sessions. Although content review can address knowledge gaps, repeatedly reviewing content alone does not help students understand how to think through those questions or to discriminate between similar answer choices. Students need strategies, right? Nurse educators need strategies that strengthen our ability to understand not just the what it is that we should teach, but why as well as when, right? That scaffolding, that building on prior knowledge. Students, our nursing students need this information, this strategy to strengthen their clinical judgment and decision making, not simply more exposure to information. We know that's called cognitive overload. We want to decrease that as much as we can with our students. And one key step in doing that is being able to scaffold and build on prior knowledge once we validate that knowledge and reinforce that knowledge with our students. If you chose C, you are correct. Congratulations. Now, we do celebrate when you choose the correct answer. However, it's more important that you understand the rationale. This is why we've changed our framework for how we even talk through these thought-provoking questions. C was teaching students to analyze answer choices. Clinical judgment requires learners to evaluate cues, prioritize actions, and select the best response based on patient safety and desired outcomes. Teaching students to systematically analyze each answer option helps them move beyond recognizing partially correct responses and to develop that higher level thinking that we need them to for success, not only on an exam, which we know is important. NCLEX is the ultimate summative evaluation that our students have to complete, and also in practice, right? We don't want our students just passing exams. We also want them to be able to apply, to analyze, and also to create meaning for the decisions that they are making in clinical practice. This approach aligns with facilitate learning and promoting clinical reasoning. So what's your level? What's your number? Do you feel confident that you're ready to teach based on us going through that thought-provoking question? Or do you feel lost and you have no idea what I just talked about? Well, the good news is you can go back and listen to it at any time. I like this. This is why we keep this actual testimonial statement because I really like what it says, not only about the value of achieving your certified nurse educator credential, which is very important. We believe all nurse educators should be certified. This also speaks to the transformation that happens. Yes, we're in a transactional process where you're listening to information, hopefully, that's helping you improve and get a little bit better every day, and also helping you get ready for the CNE exam. However, it's a transformational call to action. We want you to integrate these teaching strategies that we're talking about so you do understand the what and the why, as well as the when. This testimonial shared, Dr. Sellers Educate is an excellent source for not only CNE study, but to inform the practice of nurse educators. Any instructor or course would be improved by having faculty skilled, knowledge, and given attitude developed from this educational content. I just love this testimonial so much. Every time I read it, I like it even more because I wish I would have had a resource like what we provide in our programs. It would have certainly helped me get through some of those challenging times, and it still does even today. It helps me think more like a nurse educator. I am consistently using my resources, okay? Because I don't want you to think I'm making content up. I want you to go to the primary resource. These are practices that I'm integrating because I still teach as well. I'm a firm believer that we have to apply what we actually are sharing as our experiences. That's how we engage in shared experiences and also support a community that's going to achieve the goals that they set out for themselves. So we want to be able to think like a nurse, and it starts with having the right resources, having a consistent community that's going to support you to achieve those goals like Dr. Sellers Educate. The next component and concept that we want to talk about are three specific strategies that you're going to use to, again, help you achieve success on your exam and also help you become a better nurse educator when it comes to exam analysis. So read the STEM first. Then we want you to analyze the solutions. This allows us to understand the rationale. Number two, to do the deep work that's so important. When you're preparing for the exam, we don't want you just doing that surface work. And listen, we love Dr. Caputi and her CNE review book. However, it doesn't go deep enough. It gives us a lot of, we like to call Cliff Notes version information. Is that surface learning, gives us a great intro, and we still recommend it as an optional textbook. We encourage you to read it cover to cover. The information is excellent, and it allows you to have just a good overview, but it doesn't go deep enough. That's why you have Billings and Halstead, because it allows you to have that understanding about the why, okay, not just the what. Looking at the learning theories that's on table 14.1, and again in Billings and Halstead, that's going to be on page 249. This is really the foundation of the why, okay, and allows us to do that deep work as it relates to thinking about why is it that we use flipped classroom? Why do we use group work? Why do we have presentations in our classroom? Okay, it aligns with a learning theory. We don't just do it because it's fun, because it's active learning. There's deeper meaning to these teaching strategies that we're engaging in with our students. Applying and analyze, allowing us to know the why, the what, and then the other one I just added was the when. When should we introduce these concepts? When should we assess and validate that learning has happened? This allows us to not only analyze the solutions, because we know there's two distractors, one correct answer, but it also helps us understand the rationale. This is why we changed the format of our thought-provoking question. All right, number two, eliminate those distractors strategically. What is the distractor evaluation when we're looking at exam analysis? How is it measured? What is the range? So let's go ahead and take a look on page 489 as it relates to this specific concept. All right, and I want to go ahead and also share my whiteboard. All right, so we're going to share our whiteboard. We're going to stop sharing that screen. And this is something you can go ahead and write on your sheet of paper. I actually like to add my iPad when I do this, but I couldn't find my pencil. So we're going to use the resources we have in front of us. All right, so when you open up the whiteboard, you should be able to click on, let's see if I can get it to open. Yes, you should be able to click on share. And then if you ever use Zoom, this is how you would do it. Once you click on share, then you should be able to find whiteboard. And sometimes you can't, like right now, it's not coming up for me. But just know that what you're able to do is to go ahead and click more if you can't find your whiteboard there. And when you click more, you should see the whiteboard. All right. And then you click new whiteboard. And what we're going to do is we're not going to use a template. We're simply going to write using our actual mouse today. All right, so number one, we want you to identify just one concept related to distractor evaluation. Again, you're going to use page 489 in Billings and Halstead. Okay, so for me, I'm going to go ahead and put down PBI. All right, so PBI. Yes, it's not as easy to write with your mouse as it is with a pen. All right, so what you want to think about with PBI, we're going to use our sticky note. Okay, so for PBI, these are questions you want to answer. What is the range? Okay, so what is that range of PBI? And then you want to think about what am I going to do with this information? What am I going to do with this information? Okay, so that's what you want to think about. And then the next concept, you may write down others, but the next concept that comes to mind for me is going to be validation, right? So when we're looking at our exam analysis, that's exactly what we're doing, right? We're validating whether or not learning has happened. So validation comes up for me. How do we do that? Well, that's exactly what exam analysis gives us, right? It gives us information that validates whether or not learning has happened. So when we talk about validation, there are two parts, right? There's exam analysis, report, analysis, spelling is important. So exam analysis report is going to give us that information. And then we're also going to do a qualitative analysis. Well, how do I do that? Well, I can have discussions with my students. I can have concept review. I can have exam review. I know that exam integrity is really important to us right now. So for some colleges, they've decided not to do an exam review. All right, so that's the concept that really bubbles up for me when I think about distractor evaluation. I'm truly validating that my students who were knowledgeable about the concepts hopefully chose the correct answer more often. And how do I know that? Well, the PBI tells me that information. When you take a look on page 489, you're going to see at the bottom under distractor evaluation, it says, in addition to the evaluation of the correct answer, two, an item for a positive point by zero correlation or number one, point by zero index, effective distractors should appeal to the non-learner. That means those students who are not as knowledgeable about the concepts. Okay, I expect my distractors to be negative. That tells me, okay, going back to what is the range and what information does this tell me? If I have a PBI that is negative for the distract or incorrect answer, I have attracted those non-learners, those students who are not knowledgeable about the concepts. I've attracted them more often than I've attracted my high scoring students or students that are knowledgeable about the concept. Okay. So validation for us as educators, it's quantitative with the exam analysis report, and it's also qualitative. I'm looking at number one, my distractors, did they do their job? I'm also looking at the correct answer, and I expect for the correct answer, I'm able to validate that my students who were knowledgeable about the concept chose the correct answer more often. Okay, how do I know that? Because the PBI is positive. We always want the PBI for the correct option to be positive. We always want the distractors PBI to be negative. Okay, so that's the validation piece. All right, so that's what we want you to do. We want you to hopefully write down with a pen instead of a mouse on your paper. So your penmanship is going to be better than mine. And we want you to think about that, really process meaning to these terms that we're talking about. using Billings and Halstead, using specific examples. If you have access to an exam analysis report, that's excellent because it's going to allow you to integrate these strategies that we're talking about to create salient or more meaning for your journey as a certified nurse educator. All right, so now we're going to stop sharing this one. And you can take two steps to get out of it. You can either just close it with an X, or you can go ahead and trash it. I'm just going to go ahead and clear the page, and then I'm going to X out of it. All right. So if you haven't used the whiteboard, then you have a couple of options. You can always use your iPad and connect it, like I said, by clicking the share option, and you'll see the iPad under advanced. Or you can simply just click the three dots under more. This again is if you're using Zoom, then you'll see the option for whiteboard. All right, so let's wrap up in looking at our last couple of strategies, and then we will end our time together for today. I appreciate you all's patience and going through different tools because I think that's important. We want to engage in evidence-based strategies that are important for you to integrate and to demonstrate how you can actually use them in real time. All right, and then the third consideration is prioritizing patient safety in your answers as you get ready for the CNE exam. So here's some questions we want you to think about. How do we integrate and apply it in the didactic setting? How do we make sure students understand the value of and really be able to prioritize patient safety? Number two, what is included on your exam blueprint related to the levels of learning and how you truly align with your learning objectives, which oftentimes, especially when it's a clinical course, oftentimes there's some element of patient safety that's listed in your objectives. So looking at that blueprint, how do you ensure that students are learning, having that deep learning about patient care prioritization? How does it show up in your teaching strategies? How does it show up specifically in how you validate learning from a formative perspective? So students are engaged in conversations with us for learning, as well as summative evaluation, where we would have our blueprint and we would validate at the end that students have actually learned. And then third is going to be, what are those levels of evaluation? And we can look at Bloom's for that, looking at pages 188 through 190. What level of learning am I validating as it relates to the cognitive learning domain to ensure that students are given the opportunity to elevate their level of learning as they progress in my course and as they progress across the curriculum in the nursing program? Taking some time to pause and really reflect, because I know we went pretty deep in this snapshot. Reflect on how these teaching strategies, these evidence-based practices, are showing up in your everyday work. Focusing on your ability to truly get 1% better every day is going to help you not only become a better nurse educator, also help you achieve that passing score. We want to decrease that cognitive overload. We don't want you to waste time looking for more questions, okay? We want you to spend time looking for the answers, okay? We're going to summarize that in a second. And you can do that through acting on the information that you read in Billings and Halstead, acting on the information that you see us demonstrating, that you hear us talk about as it relates to getting better every day and ultimately alignment with evidence-based teaching strategies. So key takeaways for you. Number one, avoid using unnecessary resources. You don't need more questions. You need more answers. There's no correlation between you taking practice questions, which some of them are not validated. We don't know if that information is accurate or not. The only questions that we encourage you to use if you have a high level of anxiety related to test taking, or it's been a long time since you've taken a standardized test and you just have a lot of anxiety, that's going to be NLN self-assessment exam. Okay, but again, there's no correlation with how you do on that SAE, self-assessment exam by NLN, and how you actually perform on the CNE exam. So don't waste your time buying products that have questions, because that's not going to help you pass the exam. What will help you pass the exam is getting answers to any muddy points that you have. And where are those answers? In Billings and Halstead. Okay, so that's key takeaway number one, because we get that question a lot. Key takeaway number two, here's the question we want you asking yourself. What is it that you know? And then what is it that you still need to learn? The reality is there's information that we all need to learn. The good news is every single concept about being a nurse educator, a good nurse educator, is not on the exam. Focusing on that blueprint, that exam blueprint that is included in the handbook is going to help you stay focused so you're clear about what it is that you need to focus on to have that deeper understanding about to identify the correct option when you get to the CNE exam. Third takeaway, stick with the plan. Our 7-week study plan and our CNE in 60 days program is crystal clear. It allows you to go deep in understanding these concepts. It collapses time because you are given all of the resources when you enroll in the program. It includes all the resources that you need to achieve that 98 to 100% success rate. The last piece, though, is going to be your commitment, your dedication to following through on that plan. That's exactly what we have bundled here is our CNE in 60 days bundle, which includes Billings and Halstead, 6th edition, because that's the one that the exam writers used when they wrote the exam initially in 23. And if you have the 7th edition, like I said, that's great. There's actually a crosswalk that Elsevier developed. We asked them to, and they were kind enough to do that. That's listed in the description as well. And make sure you're not using shortcuts, right? We want you to avoid shortcuts because that can also create distraction. It took me almost 8 years to get the CNE off of my bucket list. We don't want you wasting time and money. We don't want you to get frustrated. Following the exact plan to success includes having number one, the right resources. Number two, following that study plan, committing to 120 to 130 hours of study time over the course of that 60 days with consistent support. We meet every week for an hour and a half is what's going to help you achieve success. We know that nurse educator colleagues are moving forward on the CNE journey. We're seeing more and more every year that have this on their bucket list and start to prioritize it. So if you're one of those nurse educator colleagues that's ready to prioritize your journey to finally get CNE off the list, we look forward to seeing you in our CNE in 60 days program. And for everybody else, we look forward to seeing you in the next snapshot. We hope this has been helpful and we look forward to seeing you next time. Have a great one, everybody.